So welcome everybody to the 2021 Members Forum. We're going to start with the Territorial Acknowledgement, and you're going to see a photo. Next slide. This is a photo taken from Beaumont Park a few weeks back, and even now that most of the leaves have fallen and the weather is grayer, I'm still awed by the beauty of this region and reminded to be grateful for where we live in the traditional territories of Calgary's Métis and First Nations communities. And the next thing I want to acknowledge, next slide, is that we couldn't think of a way to make this year's forum as fun as in years past. So I don't think there's a virtual replacement for, you know, the sight of balloons and the smell of popcorn and rubbing shoulders with your colleagues and sharing spontaneous group laughs with your teams. So instead, we try to keep our Zooming as short as possible, and we encourage you to enjoy your colleagues' company in the breakout room opportunity that's near the end of the agenda. If we go to the next slide, it's just a little overview of the, oops, don't have that anymore. Anyway, so housekeeping items. As a best effort to recapture the desired collegiality of our members forum, please feel free to keep your camera on throughout the event and use the chat function. And during the breakout rooms and report back, actually, I flinch at the idea of breakout rooms report back. So let's think of it as what's coming up is focus groups and reveals. So during the focus groups and reveals, you'll have the chance to unmute and discuss amongst yourselves and use the hand up function if needed. And then a reminder that the main Zoom room will be recorded and posted online after on the event landing page. So now I think we go over to Tom's slides, right?
Good morning, everyone. Just waiting for the slides to come up here. Thanks for joining us. It's a bit of a gloomy day today, but hopefully we can have a lively conversation here after a little bit of a report on sort of some of the key updates for the Institute, and then a little bit of a background on our strat plan, and then a conversation that Jamie will launch us into. As I was thinking about today and thinking about sort of select Institute updates, I came across this quote from Florence Nightingale, which I thought was kind of appropriate for our Institute, which is, "Were there none who were discontented with what they have, the world would never reach anything better." And I think it sort of nicely captures, some of what our members do, which is sort of dealing with a lot of the public health challenges that we face and then working to make a better world. So thank you. Next slide, please. So I'm going to run through a series of key updates. I'm going to start with the bad news first, which is the budget. And so the University of Calgary is currently working with the government on the 2022-2023 fiscal year budget. Not surprisingly, we're anticipating further budget cuts given everything that's been transpiring in our world. The Cummings School of Medicine is sort of working on the assumption that they're going to have to cut their budget from the university by about $3.5 million. And the Cummings School of Medicine informed us last week that as part of their attempt to do that, they're going to no longer provide the research institutes within the school, including ours, with financial support. And so we've been getting money from the school every year to help support our operations. That'll end. So starting as of April 1st, our operating budget will have to be entirely self-funded. And this is not a huge surprise. I mean, I think anyone who can read the tea leaves knows that we're in a very difficult financial situation in the province. That's we're in the middle of and is likely going to last for some period of time. So we started to think about this with our first budget last year. And in this, we'll sort of accelerate some of that planning as we think about how do we generate new sources of revenue and how do we minimize our costs while providing you with greatest value and society with greatest value for what we contribute. So that's kind of the bad news in the update. And then from now we build to positive news. Next slide, please. I want to sort of highlight that we've got a new business operations coordinator that's being hired. So many of you will recognize the picture on the left, which is MC Proul, who was our business operations coordinator for many years. She moved to Quebec just prior to the pandemic and then took a job there this spring. We hired Cal from Edmonton who's in the middle picture there, unfortunately, it turned out that he got married from the time we hired him to when he was going to come. And then turns out that based on family circumstances, he's actually not able to move to Calgary. And so I had to leave the position. And so then now what we've done is been very fortunate to have Ignacio Chua join our team. He'll be joining actually on Monday and taking over the role of business operations coordinator. And we'll have an important role to play, obviously, based on the budget that we just simply talked about briefly. Next slide, please. Coming out of the budget, one of the things I want to highlight is a new initiative that we've launched called the Health System Sustainability Initiative. And let me just briefly tell you a story here. So these are the 4 groups of individuals involved in this. On the left-hand side of your screen is a picture of David and Gayle O'Brien, and I meet with them on a regular basis. And I met with them last spring, shortly after they had met with Ed McCauley, our president, and the conversation had been about the most recent set of budget cuts. And David had sort of mentioned to Ed that, he was concerned that healthcare and inflation was going to continue to crowd out government spending on other important public goods like post-secondary education. I met with him shortly after this meeting, and David asked me, could the O'Brien Institute do anything in this space? And so after some brainstorming and some proposals back and forth, we put together a proposal for a policy initiative related to health system sustainability, thinking about how do we think about a sustainable healthcare system that allows other governments funding for other important initiatives. We recruited Fiona Clement, who's to the right there, and then Amity Quinn, who's a postdoctoral fellow with Braden Manns, to take on the academic leadership role of that. And then to the far right, we've got Melanie Columbus, who will be joining us in the middle of November as a health policy manager who will help oversee that. We just had our first steering committee 2 days ago with Steiny Brown, Dean of the Dalhousie School of Medicine, School of Public Health, and the University of Toronto, Colleen Flood from the University of Ottawa, and Braden Manns from the University of Calgary. And we're going to start working through what are some ways that we can develop evidence-informed policy options that we can then try and present to government and encourage governments to consider, so we have sort of rational thinking about long-term spending for healthcare and other public goods. So it's quite an exciting initiative. And if you're interested in that, please reach out to Fiona, Amity, or myself, or Melanie. Next slide, please. We have a series of new SAB subcommittee members, that Strategic Advisory Board subcommittee members I wanted to bring to your attention. The first is Alice Lamb. Alice on the left-hand side there is a self-described social entrepreneur with an obsession for building inclusive and sustainable communities. We're fortunate to have her join. We've got Jason Kabai, is the Provincial Lead Medical Officer of Health for Public Health Knowledge, Evidence, and Innovation with Alberta Health Services. We've had Amber Boudreau join, who unfortunately just joined, and we don't actually have a picture of her. I couldn't find one on the internet. And so she's Vice President, Engagement for Alberta Indigenous Opportunities Corporation, and a proud member of the Red Rod Band in Northwestern Ontario. And then Gary Thierry is the Scientific Director for Population, Public, and Indigenous Health at Alberta Health Services. And so all 4 of these individuals have kindly joined and volunteered their time with one of our SAB subcommittees. Next slide, please. We've got 3 new members of a strategic advisory board as well. We've got, starting on the left, Mary Tidland, who's an entrepreneur, philanthropist, and author dedicated to empowering women and children with the goal of advancing health, education, and alleviating poverty. We've got Samira Sarita, who's a lawyer and the managing partner and chair in-house council division of the Council Network. And she's really passionate about basically diversity, equity, and within the healthcare system. And then on the far right, we've got Ray Robitaille, who's a former deputy police chief with the Calgary Police Service, and has just actually started a new job as a sergeant at arms with the Legislative Assembly of British Columbia. And he really has strong beliefs and advocacy for promoting physical and mental health as a way to build a compassionate society. And so once again, we're very fortunate to have these three individuals join us as volunteers on our Strategic Advisory Board to help us think through large strategic issues. Next slide, please. I want to just highlight that Institute members continue to rack up a really impressive number of funding awards. This is what we're aware of from the last 6 months, a total of 25 peer-reviewed competitive awards. Just highlight, 10 from CIHR, from the project scheme competition, as well as special calls. 6 awards from the Social Sciences and Humanities Research Council, 2 from New Frontiers, 2 from MSI, and then a smattering of awards from other agencies. Very impressive. Just to give you a sense of some of the diversity, what I want to do is just sort of highlight 3 awards spanning 3 different pillars for you. So maybe next slide, please. So here's an award that was given to Stephen Friedman. He received a multi-million-dollar award from the NIH to fund a cluster randomized controlled trial of around 30 centers in Canada and the United States looking at hyperhydration to improve kidney outcomes in children with Chaga toxin-producing E. coli infection. Stephen's really doing work here in Pillar 2 space, which reminds us that we do have scientists that work in the space, and an impressive accomplishment given that most of our scientists don't apply to NIH. Next slide, please. We've got Deborah Marshall, as an example of a Pillar 3 scientist who got a CIHR grant for a project really related to training for advancing capacity for sustainable and patient-centered learning health systems across Canada, thinking about some of our fellow training opportunities. So an impressive accomplishment by Deborah. Next slide, please. And the last one I'm going to highlight would be a Pillar 4 scientist, and that would be Aleem Barwani. So Aleem was funded by SSHRC for a grant titled Resolving Intractable Policy Conflicts, Applying Track 2 Diplomacy to Community Water Fluoridation in Calgary. As many of you are aware, we just had a plebiscite on water fluoridation. I think it's our 7th or 8th plebiscite. So I'm under no illusions that this issue has been resolved. And I think the type of work that Aleem's thinking about here in terms of how do we resolve these never-ending policy conflicts is really important. And these 3 individuals sort of highlight some of the diversity and the types of work that's being done by our members that were sort of captured in that one slide of 25 awards. So next slide, please. I want to just highlight that those are awards, and we've got members who are really being very effective at translating science into policy and impact. An example is Sonia Battaglia. In the spring, she presented to an all-party parliamentary caucus on diabetes, highlighting the issues of how important it is to try and prevent diabetes. And then once people have acquired diabetes, the importance of managing it in a holistic manner. So thank you, Sonia, for leading these types of initiatives. Next slide, please. I'm going to run now through just sort of a list of winners of awards within our institute. It's kind of a shockingly large list, and I'm sure I'm missing people. But just this past week, Avenue Magazine announced its top 40 under 40, and we've got 3 members of the institute who are recognized. We've got Zara Godarzi, Jason Weatherald, and Monty Ghosh. Next slide, please. Jane Lemaire has been recognized by the Alberta Medical Association with a Medal for Distinguished Service for all her work that she's done in terms of physician wellness and really being a champion of it over all these years. And I love this picture of Jane because it's actually kind of captures her personality with that vibrant energy to continue to make a difference. So thank you, Jane. Next slide, please. Gina Holroyd-Duke has just been recognized this week as well as being one of Canada's 100 most powerful women. She's doing really impressive work within the Department of Medicine in terms of fostering equity and diversity in a very transparent approach while really championing science. And so we're very fortunate to have her not only as a member, but also as one of our partners from a department head perspective as we try and continue to advance science within the university. Next slide, please. We have a whole slew of individuals who have won Killam Awards of various types. So this is Gina Parsons Lee, who is a member of our institute, now actually works at Dalhousie University. She was awarded a Killam Chair for Early Career Scientists for her work on helping Canadians navigate the COVID-19 infodemic. Interestingly, Gina actually did her PhD with our mayor, with our newly elected mayor, which is kind of a neat connection there. Next slide, please. We have 2 Killam Emerging Research Leader Awards, Dr. Kirsten Feist and Dr. Regine King, doing fantastic work early in their career and blazing sort of a trail for both health services and really a population health perspective. Next slide, please. Herman Barkema was provided the Killam Research Excellence Award for sort of the more senior award, recognizing the very impressive contributions he's provided from a biostatistical perspective, as well as from a One Health perspective, highlighting once again that the Institute sort of extends into schools like veterinary medicine. Next slide, please. We've got 2 Killam annual professors, Carolyn Emery from kinesiology, who's a member, and then Penny Pexman, who is actually a member of our strategic advisory board representing the VPR's office. Next slide, please. those are sort of the awards. I want to just highlight a couple of important new positions. So this is Karen Benzies, who many of you will know, and she's recently been named as Director of Social Innovation for the University of Calgary. This for us is really good. Karen has been instrumental in our strategic planning efforts, and that innovation is a theme in our strategic plan, and having her and her expertise within our institute within this role will be really important for us. Next slide, please. I want to highlight 4 Canada Research Chairs. So two of them are members that have received chairs. So Susan Cutts has received the Tier 1 Canada Research Chair for Healthy Animals and Healthy Communities in a Changing Arctic. Once again, sort of tying into the One Health theme. Next slide, please. Susan Samuel has received a Tier 1 Canada Research Chair for Precision Medicine and Data Science and Child Health. Data science is something that many of the institutes are increasingly cognizant of the importance of, and we've been thinking about quite a bit from a strategic perspective, and so Susan's taking on this important role. Next slide, please. This is a picture of Mamas Mamas, some of you will have heard of. So Mamas Mamas has been successfully recruited into a Tier 1 Canada Research Chair for Digital Health. He's an interventional cardiologist that works at Keele University in the United Kingdom. He is an incredibly prolific scientist, as an example, publishing more articles per year than either Brenda Hemmelgarn or Bill Galley did at their sort of peaks of their academic productivity. And we've been very fortunate in conjunction with Libin to be able to recruit him to the University of Calgary, and with substantial help from the Cummings School of Medicine. And he's scheduled to arrive. He needs to get his credentialing all sorted out from a medical perspective, and is scheduled to arrive in April or late spring of this upcoming year, and will be a great addition to our institute. Next slide, please. This is an opportunity that has just being launched that I wanted to share with you, and that's a Tier 1 Canada Research Chair in Anti-Racism and Health Equity. Many of you will remember that Lynn Mcintyre and Christine Friedenreich sort of very rapidly, with almost no notice, put together an application for a Canada Research Chair just over a year ago for equity, diversity, and inclusion. That chair was very well conceived, unfortunately did not get approved, but based on what we learned from that experience, and by having a much longer runway to prepare, we were able to put together a committee this year, slightly reframe the chair to be focused on anti-racism and health equity, and it was successfully approved by the support unit, and now we're preparing to launch a search and selection process for this. That's going to be chaired by Jana Holverley-Duke, and we've got diverse representation from multiple departments and faculties across the university. This provides a real opportunity for us to recruit an international star in this space who could help us galvanize many of the scientists who are working around health equity within our institute. And so I just ask you, as you think about this, or ask you to think about this, and if you are aware of individuals who might be good candidates for this, please email myself to let me know so that we can liaise with you to find ways to make sure that this posting, when it comes out, it's not out yet. I expect it'll come out either towards the end of the calendar year or early in the new year, that we can make sure it gets in front of the right individuals to give us the best chance possible of recruiting the best person for this. It's a real opportunity, both from a health system perspective and a population health perspective, because these issues transcend both. Next slide, please. Before I jump to this, there is one additional sort of comment I wanted to make, and that is that we've just sort of learned that the Institute's been fortunate enough to be afforded the opportunity to have a fireside chat with the Right Honorable Brian Mulroney to discuss the issues of lessons learned from the pandemic and how we can build back better. That's going to be announced here in the coming days, and it should be scheduled for November 29th. And it's going to provide a real opportunity to talk about many of the issues that our strategic plan is addressing in terms of how do we think as a society of emerging from this pandemic and tackling big public health challenges that exist within our society, as well as being better prepared for future large challenges. And so please keep your eyes out for that announcement. I do want to raise this here. Did we miss anything? Well, the answer is yes. I know that I've only provided a sort of a smattering of updates that around institute activities. And so if there's anything really important I've missed, please feel free to let us know now, or send me an email, and I'd be happy to include it in a future newsletter or during a future town hall event. Okay, I'm not hearing any essential misses that we have to deal with this morning. And I apologize for important things I have missed, but we will err to correct those. Maybe we'll move on to the next slide then. Okay, I've been talking for a long time here. I promise not to speak much longer, but let me provide a brief strategic plan update. We've been doing this for a while. And in thinking about that, I thought this quote from T.S. Eliot might be appropriate, which is, "We shall not cease from exploration, and the end of all our exploration will be to arrive where we started and know the place for the first time." And so our strategic planning process started, just under a year ago. It's taken time, and I think it's been a really valuable process, as I think we've now started to get really good clarity on who we are and where the opportunities are for us to move forward. And so I just ask you that, a draft of the plan, which is close to being finalized, and you're going to help us finalize it today, has been circulated. And if you've got feedback, please share it in the small groups, as well as, or directly emailing me, because there are some final opportunities here to have influence as we kind of narrow down our focus here. Okay, next slide, please. Okay, just briefly remind you, this is how the process started. These are the members of our working group who worked quite hard last fall and winter on the plan and developed the first draft of it. Next slide, please. It's been an iterative process. We started with a situation assessment, then a strategy definition, which is almost complete. And we're starting to think about action implementation here. And then eventually we'll do performance monitoring. So we're kind of moving through this process. Next slide, please. So let me just share with you the key highlights to it, so you can, for context, before we jump into Jamie's discussion. So our mission is to advance public health through research excellence. And so we've modified that from the previous mission, with the two key concepts being that we want to advance public health and we need research excellence. And that research excellence is really an inclusive concept of research excellence, meaning how does that high quality research advance public health? And this really stems from the fact that as an institute, our unique advantage and our unique location within the university is that we really sit at the interface of university and society. And so we want our research to actually have a meaningful, tangible impact in the short term, whereas that of many discovery scientists will take many years to culminate or germinate. And our role from an infrastructure perspective as an institute is really to support you academic scholars to tackle public health challenges. And we do that through a variety of mechanisms, but the one that's highlighted there is really by bringing together the right people when collective action is required. That's kind of potentially one of our really unique opportunities. Next slide, please. The values, after a fair amount of discussion and feedback from members, we've landed on the following: collaboration, courage, engagement, innovation, integrity, and plurality. And in the strat plan, there's sort of a brief sentence that outlines each of these so that you can understand what we mean by these. But we think these are a good representation of the type of culture we have in the Institute and the type of culture we want to continue to evolve in the Institute. One that's collaborative and then one that's courageous and diverse. Next slide, please. We shrunk the number of organizational enablers. So these are sort of, I'll say, the pillars in terms of how we think operationally about what we do, down to 4. But fundamentally, we want to focus on community, that we are one community. Partnerships are critical for our members to have with various stakeholders. Funding, as I mentioned at the very start here, is very important for us to have strategic thinking about funding, so that we are thoughtful about new sources of revenue and that we have really good return on investment for the resources that we spend. And lastly, programs and services, because that's the support we provide you to that hopefully helps you to be as successful as you possibly can. Next slide, please. So I want to just highlight 4 goals within the plan before I hand over to Jamie. The first goal is operational excellence, and what you can see is on the left-hand side of your screen is that this is what the Institute does. It basically has got a bunch of balls or ratchets in the air that it needs to keep managing. And so our goal is to establish an organizational culture devoted to professional knowledge, continuous improvement, and intellectual integrity. We've got 3 areas of focus within that goal: research capacity, so building it, ensuring that we have high value of membership, and that we're strategic in our investments. I've got a picture in the upper right-hand corner there of Jamie Day. So she's our administrative director, and Jamie is going to be taking on sort of the implementation, execution, and monitoring of this goal from our strategic plan. Next slide, please. Our next goal is thought leadership. You're going to see a COVID theme come through the next 3 slides here. So the picture on the left-hand side, which says, shows a third wave in our vaccine rollout, could be modified to fourth wave in public health measures in the province of Alberta. But the reality is that during the pandemic, it's been very clear that we've had challenges at a societal level in terms of thought leadership. And so as an institute, what can we do? And I would say that our goal is to solve complex public health challenges with great ideas and resolve. And we've sort of identified 3 areas of focus within this area. The first would be knowledge exchange. The second would be innovation, and we're fortunate to obviously have Karen in social innovation, W21C, leading a lot of innovation as well. And then health policy. And so we've proposed to establish a health policy center within the Institute that would be virtual, given that the number of individuals with health policy expertise is actually fairly small in the Institute as well as across the country. And so we would aim to have a distributed center that would capture individuals from institutions in Western Canada to bring them together into collective strategy to try and help our members implement evidence into health policy. My picture is in the upper right-hand corner there, although it looks younger. It's not actually that old a picture, but I feel like I look a lot older than that already. And I'm going to be leading this goal for our institute. And we've already started to work substantially on the health policy piece. And that includes that health system sustainability initiative that we talked about at the very beginning. Next slide, please. We've got 2 goals related to research. The first one is healthier populations. The picture there on the left, I think, captures, one of the big challenges we've been experiencing as a society recently, which is around how do we get to a point where we have sufficient herd immunity to allow us to try and, go from a pandemic to an endemic state with our pandemic. Our goal is to improve health equity and the conditions that determine health. We've had discussions and we've solicited lots of advice on areas of focus. Jamie's going to share that with you momentarily, and you're going to talk about that. The individual who's kindly agreed to lead this is Christine Friedenreich. Christine is our Associate Scientific Director for Population Health. She's kindly agreed to lead this initiative. Christine is actually entering here the 4th year of her term as Associate Scientific Director, and has indicated that she won't be seeking a second term. Our terms are 4 years in duration. And so Christine will start this, and then later in 2022, we'll actually have a posting come out to search for a new Associate Scientific Director for Population Health. And we'll try and arrange for some overlap so that there can be an effective transition there. So for those of you that have interest and expertise in population health, something to start thinking about, and maybe even reach out to Christine to ask her what this position's like, what the role's like. So we're really looking for excellent people to come and help us with this. Next slide, please. And the last goal is better healthcare. So the picture on the left is a picture of the very first patient who went on to extracorporeal membrane oxygenation in 2020 with a pandemic. I don't know if you can see in your upper left-hand corner, there's a monitor, that's the patient's vital signs. And there's a number in yellow there, 67. So that's the patient's oxygen saturation. All of us on this call should have oxygen saturation levels of 92 to 99%. And that's what this patient is getting in terms of oxygen in their body while getting full life support. And so this just sort of illustrates some of the challenges that we've been dealing with from a health system perspective in the past 18 months. And so as an institute, our goal is to transform healthcare so that sustainable, high quality healthcare is available to all people. We're going to try and identify some areas of focus as well with the conversation that Jamie's going to lead here. And in the upper right-hand corner, you'll see there's a question mark there. And that's because we're looking for someone to take this on. So shortly after this, our members forum today, the Institute's going to send out a call for applications for an Associate Scientific Director for Health Systems. We're looking for someone who has got experience with health systems research, has a track record of partnering with health system leaders, securing tri-council funding, disseminating locally, nationally, and internationally their findings, and ideally has some leadership experience to help us lead this goal within our institute. And so if you're interested in this, please reach out to myself or to anyone else from the Institute. We really do need good individuals. There'll be terms of reference attached to this. You'll see it's a 4-year commitment that we'd love you to stay for that long. And I think there's a really good opportunity for us to do some really good work in this space. Next slide, please. So I'm going to show you a little schema here just to pull this all together. And I don't know this is the right little visual. I'm not an artistic individual, and I built off of something that Jamie Day initially shared with me. But what we're trying to cultivate with our strategic plan is really an ecosystem, right? And if we start at the bottom, our goal of operational excellence is to really provide the foundation or the soil for that ecosystem. We've got really two broad, I'll say, streams of growth in the Institute. We've got healthier populations and better healthcare. That's where most of our scientists focus their work, recognizing that we do have some pillar 2 scientists which would probably fall into the better healthcare stream. And then we've got these transecting currents, I'm going to call them winds or whatever, that we think of knowledge exchange, innovation, and health policy. And so our goal with this, with our strategic plan, is to really cultivate an ecosystem that thrives in itself, but also is adjacent to other ecosystems, other institutes, other faculties, other institutions, and most importantly, society, so that the work that's done by us and by our members is then able to sort of influence and improve the health of society and the health care that's delivered within our society. Next slide, please. And then the final slide there that I just wanted to show you before Jamie takes over is you'll see I put little green dots in there, or little green circles, I should say. One of the things that we want to do is we recognize that there's going to be, if you think of leaves, all the individual scientists doing the various work, is that within that ecosystem, there are going to be concentrations or clusters of activity where we've got people working together, where there's a real opportunity for us to have a societal impact, and where there's a real opportunity for us to have world-class research and world-class impact. And so what we want to talk about now, and I'm going to hand it over to Jamie to do so, is to think about within all the work that we're doing, where are those opportunities where we might think about strategic investments to bring more people together into teams to try and have a bigger impact. Okay, thank you very much, and I'll pass it over to Jamie.
Thanks, Tom. All right. So while we're waiting for that first slide to pop up, I can just tell you that over the last few months, we've taken various approaches to narrowing down the broad range of work that is done by the members into these kind of focus areas like Tom just said, where we could concentrate our limited resources to synergize significant numbers of members, and always aiming for this goal of, you see in the upper right-hand corner, of high societal importance and high member capacity. So we collected a lot of data and conducted extensive analyses looking at bibliometric outputs of more than 500 members of the Institute, doing an environmental scan of more than 35 other organizations that work in public health, and considering the extent of member activities within CIHR's classifications, their themes and sub-themes that they consider health research. And so to keep things as brief as possible, and because those exercises didn't really help us narrow down the significant breadth of important topics that are conducted by the Institute members, so I won't be presenting any of that data today. Instead, we found the most helpful approach was speaking with key stakeholders about their priorities and how they see the Institute contributing to those priorities. So I'll summarize what we heard in those discussions. Next slide, please. Notes here. So we were fortunate to gather input from CIHR leaders, from health system leaders here in Calgary, a few of your colleagues, and subcommittees that were struck to help us understand our community's research interests. And so for ease, we broke most of the discussions into either health systems research or population health research. And quite quickly, we heard that there was some consensus that the Institute might stand out from the crowd in the area of intersection between those two. So these areas between Tom's two trees. So we acknowledge that the divide is somewhat artificial, and I'll get more into that later, but we'll go through these two overarching themes separately. And the last row in that table is you. We're looking forward to hearing your thoughts in the upcoming breakout rooms. So from our discussions, we considered the input of stakeholders from their different vantage points. So, our health system leaders talked about their priorities in the context of what they're looking for help in terms of research evidence for best practice, and priorities from the CIHR reps were considered a good clue for us as to where we might anticipate funding opportunities to become or to remain available for members. And at our focus groups, we asked members to share thoughts, among others, on areas of existing capacity and excellence in Calgary. So next slide. So we compiled the feedback of different groupings, and then we looked for themes that were brought forward by more than one of the groupings. So the potential focus areas that were brought up by all the stakeholder groupings were then synthesized into this framing of primary focus areas. So just remember, this is just a draft to help us garner your input, but that's our definition of primary for this excellence, is that we heard it from all the different types of groups we spoke with. So the concept of learning healthcare system came up front and center in all the stakeholder groupings, where our health system partners want help, where CIHR plans to keep investing, and where our members are aware of significant local strength. And a definition I've heard of learning healthcare system, just to frame this, is alignment of science, informatics, incentives, and culture to achieve continuous improvement and innovation with best practices seamlessly embedded in the delivery process and new knowledge captured as an integral byproduct of the delivery experience. So this applied rather than theoretical approach is being thought of as our best chance to build back better after the pandemic, working for sustainability in the challenging fiscal times that Tom spoke of, and working towards seamless care. So then second there, digital health also featured large in all the discussions, with thoughts that, technologies, virtual care, remote monitoring, big data analytics and artificial intelligence, smart wearables, data capture, storage, and exchange, that all those technologies have the potential to improve health by improving medical diagnosis, database treatment decisions, digital therapeutics, self-management of care, and person-centered care. And we're hearing about avid uptake of digital health solutions for virtual and distributed care throughout the pandemic. So I think there's no going back, and we can't not pay a lot of attention here. And then third here, citizen engagement was proposed by all our different stakeholder groups as an important way of ensuring that our communities are meaningfully involved in policy or program development in health systems, and that patient experience is never overlooked. So again, the pandemic has shone a light on the importance of health literacy. And I found it really interesting, for example, that our health system partners talked about how research in the area of health literacy, social science research, I would imagine, could be really important for them in terms of managing people's growing and often unreasonable expectations of the health system. So again, this is just a framework that we've come up with, but these are, you're going to see some of these bullets in an upcoming poll. So start having a think on where you see yourself or where you'd like the Institute go, because that's what we're going to poll you on and then discuss in the breakout rooms. So next slide, please. So these are, by our working definition, the secondary focus areas are the ones we heard in more than one, but not all of our discussion groups. And so you can see that some of these could be considered cross-cutting approaches, like knowledge exchange or innovation, that those approaches would be critical to the proposed primary areas we saw in the previous slide. Equity, healthcare equity rang loud and clear in all discussions as an overarching goal for all the focus areas. Optimizing the workforce would be an important part of the sustainability and system redesign focus in the previous slide. And the healthy cities and Indigenous health feature prominently, you will see in the upcoming population health focus areas. Next slide, please. So, yes, now is time to go to our poll to ask you your thoughts. We're going to give you a few minutes about, which of these speak to you? Where do you think the Institute should be going? To kind of give us some feedback that we'll discuss further in the breakout rooms or focus groups, since we don't want to think of them as breakout rooms, but yes, and we see the results popping up in front of our eyes.
We'll give it 30 more seconds. Half of the people have, or half of the participants are just filling it out now.
Thanks, Liz.
We'll end the
Just
poll
one of-
there.
There you go. Just one of the new tools we've come to rely on during the pandemic. Okay, interesting. Keep that in your back pocket for our upcoming discussions. Is that our time, Liz? Should I go to the next one?
Feel free to.
Okay, so next slide, please. Okay, so now switching to potential focus areas in the theme of population health. Done the same thing, a compilation and framing of what we heard from all our stakeholder groups. That's our working definition of primary for this exercise. Again, areas in which our health system partners are looking for best evidence, areas where we might anticipate funding opportunities for members, and areas that some of your colleagues suggested as important and or our local area of strength. And again, a heads up that these bullets are what will show up in the second poll. So equity came up number one in all discussions. So anti-racism and reconciliation were top of mind, with consideration not only to the subject matter itself, but also to our approach with research teams, study subjects, trainees. And then with the upstream determinants, we were reminded to be vigilant of the tendency to slip downstream, that although upstream issues are difficult and complex and time and energy consuming, the biggest returns on investments, at least in the traditional definition of public health, have been in addressing determinants of health that are very far upstream. So, and we also heard that our terminology that includes vulnerabilities is not ideal, but there is nonetheless a big appetite toward reducing social and structural barriers to equitable health. That's the way we were looking at it. Now, equity science and methods, I found this very interesting. The idea that we need to develop and use methods and data approaches that avoid focusing on the mean and instead examine the margins with approaches including community engagement, emancipation, decolonization. And then we heard a lot of ideas to consider in terms of measurement and analysis. And I think all of these could be comprised here. So group-based modeling, avoiding the pitfalls of artificial intelligence, using careful mixed methods approaches, the need to access and use and link data from provincial ministries other than health and other existing databases, and improving collection, linkage of race, gender, and marginalization indices. And again, the use of digital technologies combined with community engagement to arrive at a consensus. So, and then the second big main theme there, healthy communities, and that was suggested as a way to focus on health outside the healthcare system, with consideration toward different types of communities or populations and different elements of community, including the natural and built environments. So upstream prevention happens in the community, guided by policies from all levels of government. And all our discussants acknowledge the importance of upstream health prevention in the community as a way to make the future of health not only better, but more sustainable. Then third here, the public health system resilience. We combined a bunch of ideas into this straw dog focus area. And this acknowledges that there is a system, or there should be a system, or a stronger one at least, that is differentiable from the medical health system that we talk about in health systems research. And the visibility and understanding of this system, the public health system, has been increased a bit by the pandemic, but much more could be done, hearkening back to the early days of public health. So while public health emergencies help shine a light and provide valuable grist for the mill, we could be focusing on solutioning public and population health beyond emergencies. You know, and so improvements to implementation science, for example, would include consideration of unintended consequences, and by avoiding focusing solely on the positive outcomes and not ignoring negative outcomes. So a lot of things we could be doing to improve things that way. So next slide. So again, we also compiled what we considered the secondary focus areas that we heard in some, but not all the discussion groups. So, and some of these could be considered cross-cutting approaches or lenses of for all the focus areas that I just showed you on the previous slide. So things like critical perspectives, especially from social science disciplinary expertise on how politics and power colors everything in public health. And the need to consider the full lifespan from, family, pregnant women, children, adolescents, adults, including women past childbearing years, all the way through seniors, as a cross-cutting theme, and similar advocacy. So the potential for members' research to be used not just to inform, but to advocate on critical public health issues. That could be considered a cross-cutting theme. And then others of these bullets could be comprised within the framework I showed on the previous slide. So for example, mental health, substance abuse, and rural populations could be considered within healthy communities, and cost avoidance economics would fit under prevention. And it would also help us lobby for public health system resilience through adjusted government investments. So that takes us to, I forgot, climate change was pointed out as highly important, but it didn't get mentioned, unfortunately, as an area of existing local capacity. So, all right, so next slide. Yes, now we're on to the poll on the pop health focus areas. So yes, let's get an idea of what you think of this, potential framework that we'll discuss more. And always considering future societal importance and local excellence capacity. And very soon we will take you to the breakout groups so you can virtually rub shoulders with your colleagues. Nice. Maybe actually while the poll is continuing so that we have more time to talk, let's go to the next slide. Because this is just a reminder that that's what Tom was talking about with his trees and overlapping trees. So before we move into the focus area groups, I wanted to point out that in most of our discussions, we did hear that that area of overlap between health services and population health research is particularly fertile. It presents a great opportunity for societal impact, and it's possibly a niche in which the O'Brien Institute could pull away from the pack, that we were already kind of different from our other comparators. And so there's lots of examples of that. Focusing on prevention from our pop health list would help increase healthcare system sustainability from our health services list, and support more equitable community-based health, which we heard in both sets of discussions. And similarly, the equity science area from the population health side and the digital health area in health services side are synergistic. And another obvious example, the citizen engagement focus in health services should be intimately entwined with, equity side in the pop health area. So although we've been proposing areas of focus within this rather artificial divide between health services and population health, it behooves us to keep thinking about this overlap area. Is it within each potential area of focus? Is it its own area of focus? It's a great topic one way or the other for the breakout rooms coming up in a few minutes. And then last slide before we free you to your chat rooms is just go into these, the discussion of your focus groups with thinking about these considerations. What's going to be important to society in the future? Bill always talked about, where the puck is going. What are existing areas of high capacity strength and reputation in Calgary? Given our limited resources, we probably can't create something new that isn't already a significant capacity already in Calgary. What would be compelling to members, funding agencies, the public, and donors, since that's where we get our resources, and what can make the Institute unique or stand out. So I think that's the end of my slides, and I'm handing over to Liz to introduce us to the breakout rooms, the focus groups.
All right, so welcome back. That was super short. Not everyone got a chance to speak, and I was rushing people through, and I realized I missed a couple as well at the end. So we'll do our debrief, and we'll have one person per group speak on behalf of the group. And the idea is not to do a full report where we sort of list every point that was made and then people will start turning their videos off and logging off. And so the idea is to capture like one or two really insightful points or sort of ideas that stood out, stuff that hasn't been said yet. And so it's an opportunity to be creative. We'll try and keep it limited to like, under 2 minutes per group respondent. And if you go over time, then Tom will start singing Bruno Mars off key. And so we want to be careful that that doesn't happen for the sake of the Institute. And so we'll start with group one. Were you able to assign someone to speak?
I think that's our group. So I will speak on behalf of our group in the health services group one. We spent most of our time discussing how health equity or healthcare equity appeared in the kind of health systems group, but health equity also appeared in the pop health group, and what the relationship should be between those two. And we had some discussion that while they are, have different methodological approaches, there's certainly undercutting themes that are relevant to both. And so we talked about, should this be an area of focus for both the health systems group and for the pop health group, or should it be something that is more cross-cutting across the Institute that is instilled in all of our research activities? And we had some discussion about the importance of partnerships and of working together and bringing people together in the health equity space who have different disciplinary backgrounds. And we also had some discussion about how equity is now seeming to be more and more of a focus for CIHR, that they're now requiring EDI plans for all team grants. And so there is some difference between having equity be part of our research as well as, which is different from having an equity focused research program. And so we just had some broad discussion about that. We didn't come to any firm conclusions about what the right way forward is, but just some observations that this is clearly an important topic for members of our Institute across the different themes. So I'll stop there.
Perfect. That was great. Kirsten, I think you were group two, right?
Great, thank you. So we focused a little bit on areas that are maybe missing. And so one of those is considering both the geographic distribution of care, so ensuring that rural healthcare is a priority, but also the continuum of care. So pre-primary care, primary care, acute care, community care, rehabilitation, all of those things need to be considered in any kind of health systems approach. We also talked about kind of innovation and what things are particularly innovative, including engaging citizens in research, and also thinking about what we're doing from an entrepreneurial perspective, which would mean considering kind of prevention as one of the key areas where we can have a large impact. And so the other thing that was discussed as important is focusing beyond just the local and the provincial, but what our innovations in research and impact can have in Canada, and perhaps even more broadly from there. There was a little bit of discussion. We never really came to a conclusion, just that the boxes that have been outlined are big enough that really any member can fit into them. And so you avoid getting siloed into disease-specific areas, which was clearly intentional from the way this was designed, and ensures cross-cutting. However, we also don't want to get bogged down in details in terms of what the areas of focus are, so that they can resonate with multiple stakeholders, particularly those who are external to the Institute and who play a really key role there. So I think that's where I'll stop. Thank you. Great.
Yeah, excellent. Group three.
Sorry, I failed in my role of picking someone. Deb, would you step in at the last moment?
Sure, I'll try. I didn't write any notes while we were talking. So I just thinking of one of the things we're not supposed to talk about what other people talk about. So we talked about the intersection between population health and health services, and how that was a really important area for O'Brien that could really excel. We have a lot of researchers working in that intersection, and so that would be really helpful. We talked about the importance of prevention. We talked about the erosion of the public health departments within public health systems, and sort of better understanding what we all mean by public health systems. And we had some discussion about what that might mean and where that fits. And then we talked about looking at the margins, I think, and that important, and in terms of examining the data. I think that's all. Anyone else want to add to what I've said?
Yeah, I tried to tap Sonia and she said her little guy just hurt himself, so she's out. Sandra or Lauren or Amy have anything to add? And then Bonnie Lash was had to leave early. So anybody else from our team? Sorry about that. Okay, on to group 4 then. Thank you, Deb.
Thanks.
Great, thanks, thank you. Thank you for that impromptu work, that was great. Group 4.
Okay, I think I'm presenting for group 4, if I'm not mistaken. And so it was an interesting conversation. Could have gone, I think, probably for hours, but some of the top points are related to the fact that we sort of identified some top themes based on the poll around healthy public policy, prevention, and upstream determinants of health, and then some sort of overarching or cross-cutting themes highlighted, such as anti-racism and health equity, which would embed across those, and how there's there's lots of connections between those perhaps TOPS identified priorities, although as one of our members pointed out, certainly it was difficult to really tease out what the top 4 were. I think that in general, there was some consensus around really looking across the lifespan, prioritizing multidisciplinarity and really ensuring that we're bringing together community and health systems and avoiding silos between health systems and population health, and really connecting to community. And then I think the last point, well, actually life journey to sort of anchor the healthy public policy, prevention, and upstream priorities. And then the last point, which was brought up with some considerable discussion, was around just the discourse, and are we losing the essential ingredients to public health, losing social activism side and root causes for poor health and inequities, and perhaps highlighting some clash between those priorities and perhaps priorities on the healthcare system side or institutional priorities. So I don't know if anybody in our group wants to expand upon that, but I will leave it at that. Thank you.
Great. I'm seeing nods, and Jason said thanks. So I guess not much to add. So that's great. So I think those are our four groups. I want to open it up now. I think we've got about just over 20 minutes for a group discussion. And I wonder if, because those breakout rooms, felt shortened, and I think many people felt it was short, I think there are people who didn't get a chance to speak in those breakout rooms. I wonder if we open by giving a chance to those who didn't get a chance to speak. Let's just give them a chance to speak in the open here to start, and then we can sort of open it up to everybody after that. Okay, well, I guess that means that breakout rooms were exactly the right length. And I was in another meeting earlier today where there was a double 5-minute warning, and so they said that was on purpose. We don't make mistakes, and so that length was perfect. Brian and Sue does not make any mistakes. So let's open it up. Let's sort of feed off of what we've heard so far. Let's sort of get deeper on some of the conversations and threads that have already emerged. And I'll let anyone pick up on anything that they find interesting. And you can put your hand up. You can send me a private chat. You can send a note to anyone on the O'Brien team, and they can send it to me if you'd like it to be anonymized for me, at least. Anything that works. We're not doing the Twitter live stream thing, so otherwise we could have offered that as well. But yeah, hands up or unmute, and I'll watch for it, or through a private message.
Elaine, it's Judy Birdfell. I'd like to pick up on a comment that Jason put in the chat a while ago, asking how is the public health system considered within this as part of the overall healthcare system. The whole focus on a learning healthcare system, it seems to me, if we accept the life journey kind of analogy. I felt like public health was kind of left out of that health system learning part. And I just would like some clarity from those of you who've been deeply involved in this. Shouldn't the system include everything from birth to death? Just wondering.
Yeah, so does someone from the strategic planning team want it? Tom, or does one of you want to sort of field that?
That's a great point that was made by John and by you, Judy. And so I guess the question would be, I think conceptually a learning healthcare system has been conceptualized within healthcare, as opposed to what would be considered more population health. That would be sort of the traditional conceptualization of it. And that's where that area of potential concentration arose. Now that doesn't mean that we as an institute couldn't think about redefining it if we thought that some of the concepts of public health should fall within that area of focus. Conversely, they could fall more within a population health focus. And once again, as Jamie's highlighted, it's a bit artificial how we've done this. It's partially done intentionally because most of the scientists in our institute work most of their time within those two sort of areas of focus. But then we've got individuals like David, who's on the call today, who, I would say actually in some ways maybe functions more at the interface. And then we've got some scientists who have jumped back and forth. So I don't have an answer there. We could think about redefining it, or we could think about tucking it in under population health. Clearly, I think we've heard from members that the pandemic has highlighted that some of what I'll call our more traditional thinking about public health has been eroded, as Deborah pointed out, and that's a problem. And then the question is that an area where we have expertise and where there's an opportunity for us to concentrate efforts to make a difference? I'll stop there and see what others think, or if there's other comments.
I was reminding people in our breakout group that, for one thing, there used to be a Department of Wellness in Alberta government. And at a Campus Alberta meeting quite a few years ago, we had somebody speak, and I can't remember which ministry she was from, but there was at that time a kind of a cross ministry. They were doing their best to, between social services and education and legal or whatever, to try and break down those silos. And that's what I was thinking would be required. The health system side has Alberta Health and AHS, and they know about, I saw Jim's comments about where does primary care fit in and everything. It's kind of like a known entity, the pillar 3 system, if you will. And doesn't there need to be a similar system for like the pillar 4 kind of stuff? And what would it take to make that happen? Is that what like resilience would require?
I see Deb has raised her hand. So Deb.
Thanks. I think it's really important to think about sort of population health researchers and health services researchers. But I think when we look at Alberta, before the experiment of Alberta Health Services, started pulling public health practice where there was a focus on population health from, for instance, they used to be part of the city. And they got pulled into health services. And so that small voice within health services of public health kept getting sort of overshadowed by all of the challenges that the public health system had with cardiovascular disease, and that small voice that was talking about prevention and promotion was getting lost. And some other provinces have started to do the same thing that Alberta did. I know Ontario was really fighting so that they would remain separate. So I think we have a situation in Alberta that evolved over time. And I think is partly the challenge that we experienced with the pandemic in terms of the erosion of all of the supports that were there for public health. And I'd love to hear what Jason has to say about this too. Thanks.
Yeah, Jason.
Thanks, Deb. I mean, I think you captured the history, the trajectory towards integration and centralization that Alberta definitely was early in that, and then others like Nova Scotia and now Saskatchewan has a very similar model with an integrated single health authority. And I think it is a big challenge because the downstream shift and the way budgeting and planning has worked and the lack of strategic planning overall for public health as a system. And I think challenges definitely working with different governments. I think provincially with, sometimes, as I think was just put in the chat, Jim, partisan risks with public health and relationship with provincial government, and then the lack of mandate and local accountability for local public health action and working with partners sort of in the old historical way public health did earlier. So a lot of relationships and softer things driving the work. But I think now the positive during the pandemic, a lot of increase in profile, just speak to Dr. McDougall's work in connecting with AHS leadership and building the opportunities, I think, to take a more comprehensive and I guess ambitious approach to taking public health action going forward on the AHS side. So I mentioned in the small group, my main point is I think as much as we can try to be co-planning and working together to focus on priorities and supporting a more connected public health system from the fragmentation that we've had historically is one key step. And so I think the start is really good with this process, and just to again acknowledge though that the challenge we've always had, I think, with like the population and health and prevention research groups, it seems to be coming up again with the priorities, is just there's so many and they're so abstract and high level that we need to figure out how to actually, maybe it's the how to focus on and really building that system piece together. So a few thoughts there.
Yeah, that's great. And I think it speaks to like any strategic planning process, right? Where you almost want to like have that uncomfortable broadening before you sort of narrow into back down into the how. And I think we're sort of moving into that space, but I see Tom's hands up. So Tom, go ahead.
Just a quick question of maybe Deborah, Jason, and others. So what could the Institute, I mean, what you've both spoken to are really our societal challenges, right? And so the question is, what could the Institute do within the context of it being a research institute, right? With primarily researchers who we want to intersect with society to address, this gap that you've identified and Jim has identified as well in the chat. So how could we think about that? And does that help us as we think about areas of concentration or focus?
I'll just respond really quickly. I think it's just an incredibly ripe area to study and for partnership to, do a truly integrated knowledge translation approach to it. What are the problems that public health is facing and what are some of the solutions, and working together? So I think there's an implementation science piece around introducing evidence into implementing these things. The policy piece, I think, is huge. And so I think that there's just a really great opportunity to work together with public health to address some of the questions that are really there for the answering.
Great, Lindsay.
Yeah, thank you. So a lot of what we talked about in our group, and I think here as well, is just the imperative of interministerial efforts and activities. And public health has a long tradition of thinking this way. So it started with healthy public policy, social determinants of health, health in all policies. Now it's going even further in the form of a well-being economy. And, there's also been episodes in Alberta's past that are relevant here. So I think Jamie was maybe talking about when we had a Ministry of Human Services. And then under the Redford government, we had the social policy framework. Like those were actually really good efforts in this regard. So I feel like, and maybe this is already in place and I'm not privy to it, but if there's a way for the Institute to be privy to these interministerial opportunities, or discussions in the Alberta provincial government. I think that would be really key. So we should not just be talking to the health ministry. In fact, that would be a terrible idea. We need to know what's going on in terms of the interministry communication and opportunities for us to be in that space.
Yeah, and it speaks to the important non-research adjunct roles that support research as well, right? Because if you don't have those relationships, if you can't maintain those relationships, you miss out on a lot of good work that could occur and opportunities that might emerge. Amy.
Yeah, just picking up on what Lindsay was saying, I completely agree, but I think one of the roles for the Institute there is with the advocacy for data for cross-ministry work. A lot of health and well-being happens outside of the hospital setting, and I feel in Alberta we're really fortunate to have access to really strong health data, but not necessarily the same degree of access to well-being data, which happens in fundamentally not the traditional health sector. And if there's opportunities where other jurisdictions have really linked that data to create more comprehensive pictures of how their population is doing, but also what sort of the impacts of their different interventions in the healthcare system are outside of the healthcare system as well. I think they've had opportunities to look at health and well-being in a more broad lens. And I think that's something that from a research perspective, we would benefit from and be of interest to many members, but also would potentially be of societal benefit as well here.
Yeah, really important point. Great. So I guess so I think that thread is, I think we're sort of moved down that thread. Any other threads people want to pick up? Anyone want to change gears and talk about something different? Tom, are there, James Dickinson.
Yeah, I think I'm the implementation end of things. That's what the front line is about. And that's an issue that has been mentioned repeatedly. We need to be studying that. And one of the difficulties is we've got lots of data what happens inside the hospitals and the healthcare system. Not a lot of data, as Amy pointed out, about what's out there. And so it's too easy to simply study the data we have rather than the data we need. I wonder whether that's one of the issues. And that article that I referred to everybody talks something about that. I mean, one of the things that puzzles me, and I want to understand, why it was this O'Brien Institute for Public Health didn't engage either as an institute or by most of its members on a prominent public health issue, namely fluoride. I mean, there are honourable exceptions amongst you, but not many. I mean, most members didn't even sign up for a lawn sign. And I know that because I've been writing thank you letters to our donors on our public list. Now, I know that most people here are involved in some aspect of public health and are very passionate about their particular bit. And yeah, COVID's obviously very consuming for all of us. But can members only hold one idea at a time? I think we have to be helping one another so that when somebody in a particular area is doing something about implementation and needs help, we need to be helping one another to put things into practice. Now, the fluoride issue was a very time-limited campaign with a definite end, but if it had gone wrong, it would have had very long-term effects. Fortunately, it went the right way, but I think it's no thanks to the Institute for Public Health or no thanks to public health medical officers in this province. And I'm concerned that that's a major failure, and it's an example, maybe, that we have to think about. Is that how we're going to behave in the future when something else comes up? I think this institute really needs to reflect on that. So now I'd commend you that article about the failure of modern public health, because I think we have a real problem here.
I want to pick up on the thread of implementation and especially primary care, because that came up quite strongly in our group, and I think it resonated with the broader group. And so if we pick up on that thread, recognizing that the institute is housed next to a quaternary care center, and so there's sort of natural alignments that occur as a result of that. What could be done through a strategic plan that could help bring in that stronger primary care and pre-primary care mindset to be more inclusive of the full continuum? And so, open for anyone to jump in on that.
Perhaps I could mention that as someone who spent a lifetime in primary care, part of the problem is there is just inadequate research money and research development in primary care. So we find it very difficult to speak for ourselves in research forums, because we're simply spending all of our time facing forwards to the incoming fire and not about thinking strategically about how to develop. So that is a major problem, particularly for family medicine in Canada, that it's underfunded and particularly unfunded in regard to research about its role. So that's something that other people in the system need to understand, that it's basically unable as a group to speak up very well for itself.
So what I'm hearing is a need for advocacy for primary care research and support, which would be a strategic planning module outside of the Institute. But I think the Institute members can play a role in that. And I think we can sort of speak to that a little bit later. But I saw Lara Nixon unmuted and Christine unmuted, and then Tom and Carolyn have raised their hands. So Lara and Christine, if you had something to say, we can sort of go to you first, and we'll go to Tom and Carolyn next.
I think I would echo what Jim has said. I think there's many structural factors. The nature of primary care in of itself, with continuity being at its core and that imperative, you need to retain a certain presence in frontline care, and it needs to be continuous to maintain those relationships and that knowledge and that presence. As well as the retention of the expertise, I guess. And our training, the residency program structures don't really lend themselves to great involvement of residents in research. And so I think there's a few structural pieces that I'll just stop at that, but agree with what Jim said.
Yeah, great. Christine.
I think I'll actually pass and let Carolyn and Tom have a chance to say anything.
Okay, Carolyn first, and then Tom, because Tom's lowered his hand.
Okay, thanks. And yeah, just reflecting on some of your comments, Jim, I think that, I picked up on your statement that we use data that we have access to a lot as a community, a research community. And I think that there's many people that are trying very hard to collect data outside of that to answer key questions that are in the space. And the capacity to do that without the engagement of the other ministries is quite difficult. And so I think that, some solutions sort of more upstream and collecting data out in the community for bringing together some of our areas and getting out of our silos. So I know concussion and injury in youth probably isn't front of mind for a lot of people during this last year and a half, but I think there's a lot of things we can learn around collecting that data more upstream, and look forward to more discussions in that regard.
Great. And Tom, did you still want to say something?
Sure. I'll just make a couple quick comments here. The first is that I think it's important to be clear that that the Institute has been grappling with the concept of advocacy, and it's really at this point landed on this position that it's not going to engage in advocacy work, because we've got over 1,000 members. The ability to come to a consensus on what members would advocate for or not is incredibly challenging. And what we really want to do is support our members to be able to advocate for their own science to have an impact. We have solicited feedback on when we should make public statements. And that was circulated to all members. And if people want to provide feedback on that, we'd love to hear about that, so that provides some guidance for us. I think Jim's comments and Carolyn's comments around data are really important. And I think actually Lara made that comment as well. And so maybe when we think about the concept of, we could say it's digital health, but really as part of that is the construct of access to data and using that data in a mechanism. And as Jim points out, we don't want to be constrained in terms of where we look just because that's where the data is. Although we want to leverage what exists. So that could be an opportunity for us to try and think about inter-institute data. And, there was an earlier comment made by Judy around that concept. And then the last thing I'll say is that, I think we're also really fortunate to have Sonia Lee as our current department head for family practice, who's really helping to build research capacity within family practice, with individuals coming on board. And so, and I recognize that that's a very long-term process. And as an institute, we might want to think a little bit about where do we have existing resources to function. The reality is the provincial budgets are going to result in the Cummings School of Medicine, the broader university, and the institute itself contracting in terms of size over the coming decade. So we're going to have fewer individuals. And so one of the ways for us to potentially navigate that is to think beyond Calgary and to increasingly engage members from other institutions, both as collaborators as well as institute members, for us to grow strength, because it's going to be much more challenging for us to grow it internally here at the university.
Great. Any reflections on Tom's comments? And I know we've got about 3 minutes left before we have to close. So yeah, go ahead, James.
Yeah, I fully understand the institute as a whole trying to do advocacy. That's not going to be possible. What to do is develop a mechanism so that we can help one another. When an advocacy program is being set up by somebody, to let others know this is what's happening, so that we can help one another, sort of associated with the institute, but not as an institute process. But at the moment, that's really not happened at all. And, I'm concerned that, in the discussion of successes, that wasn't even mentioned. But, enough.
Great. And I'm realizing I've also received several comments about my empty bookshelves. So I've received more comments about that than anything else. So it's actually an art installation, a testament to a post-truth society. So no books, just empty shelves. And so I think we're closing in on the end of time here. If there are no further sort of closing comments or closing notes of wisdom, I'll hand this back to Christine, who can steward the next segment onto the awards.
Thanks very much, Aline. I get to do the really fun part of this members forum. And so it's my extremely great pleasure to be able to announce the winners of this year's O'Brien Public Health Awards. So our first award winner is Dr. David Campbell, who is receiving the 2021 O'Brien Institute Emerging Research Leader Award. So
Thank you, Christine. I think it cut out, but I think I am supposed to say a few words. So it's truly an honor to have been chosen for the Emerging Research Leader Award. Having trained in this department and institute for more than 10 years, initially as a medical student and clinical trainee, then as a graduate student, and now as junior faculty, I've attended many institute holiday parties formerly hosted in the HRIC atrium, and had the opportunity to see many wonderful colleagues and friends win this award. I feel humbled and honored to be among their company. I need to acknowledge the wonderful community that we have here in the O'Brien Institute, which I think often we take for granted. This institute and its members have truly built my research career, starting with Dr. Billy Thurston, who was my first research supervisor during medical school, to Dr. Braden Manns and Dr. Catherine Kingshire, who were the best PhD co-supervisors one could hope for. The entire ICDC and nephrology research team that I've been able to work with for years, and Dr. Carrie McBride, who was involved with my postdoctoral work, and on to the dozens of colleagues that I now collaborate with since coming on faculty, and countless others, faculty, staff, mentors, and students who have had such a profound positive influence on me. So my successes in this award truly reflect the contributions of so many friends and colleagues, and thank you all very much.
Thanks very much, David. That was very eloquent and heartfelt for sure. So the next award goes to Dr. Cheryl Barnaby, as she's receiving the 2021 O'Brien Mid-Career Research Leader Award. Over to you, Cheryl.
Sort of like, we didn't coordinate, Dave and I, but I was also going to just do a little trip down memory lane as well. I really stumbled onto this. I was going to be a rural family physician. That was my total goal in life. A series of events led me to rheumatology and research, and I'd come here actually just for my clinical fellowship, planning to go back to Winnipeg. And anyways, things happened. I ended up being interviewed by Marilyn Hebert actually for the grad program. And after meeting with her, sat down at my desk and realized I was pregnant. And then luckily Doreen Raby kind of talked me through how I could do a graduate degree and have a clinical practice and have kids at the same time. So thanks to Doreen. I've again also received such great support, sponsorship and mentorship from many people, but most importantly from people in O'Brien, and also mentioned McCaig Institute as well as a co-member there too. And I just appreciate all the opportunities and flexibility that people have had given me or allowed me. So thanks very much, and look forward to seeing what Dave does, because he's a superstar.
Well, thanks very much, Cheryl. That was a lovely speech, and I think we all really truly appreciate your contributions. So the next award goes to Dr. Turin Tanvir Chowdhury, and he's receiving the 2021 O'Brien Institute Societal Impact Award. So over to you, Turin.
Thank you, Christine, and thank you, O'Brien. And this is an humble experience. I came to Canada in 2010, April 7th to be precise, to do a postdoctoral fellowship under our very own Brenda Hemmelgren. So when I came here, I had this postdoc on my right hand and my accent on my left hand. With time, the right hand thing changed. I became a Canadian immigrant. I became Canadian. I became a faculty member with the Roy V. Chair support. And then I moved to family medicine as the research director. As you can already realize, the left hand thing didn't change, right? The accent is still same. But that component, I think, had a huge influence on my searching of my academic soul, my academic niche. And I decided like, okay, so I would love to build on the work we can do with the visible minorities, immigrants, and racialized communities. No doubt, Canada is one of the biggest, one of the brightest candle in the world in terms of multiculturalism, mosaic. But there are shadows in the base of the candle, and I decided like, hey, I may be able to make myself useful working at that domain. And I am whom my mom and dad contributed to, working hard to make me privileged, having the privileges of world, my wife's constant support, sacrifices, and tolerance, my brother and my two sons making my life fulfilled with love. But I want to dedicate this hour to the people of Calgary, especially the racialized communities, different organizations working with them, just because they let me work with them. Thank you so much to them. And it will be a dishonest thing, because I am who I have been made by my peers in the Cummings School of Medicine, in YPH, in our research group. They've mentioned a couple of places. And without their support and encouragement, probably I couldn't have done anything, because there was a big shift. I was a number cruncher before. Then I started working with the community and people. I'm so lucky that I make the decision. I'm so humbled that O'Brien and everybody appreciate that. And thanks for this.
Thank you very much, Turin. And I want to point out one little fact I learned about you from our VPR. And he said, you are a remarkable person because you are the person in the University of Calgary who has submitted the most grants. So kudos to you for being so willing to submit many research projects, but also being successful. All right, well, thanks. Now we're very happy that we can announce the next award winner, and this is to Dr. John Conley, and he is going to be receiving the 2021 O'Brien Institute's Research Excellence Award. And I'm very happy that Dr. Conley has just been able to join us. So over to you, Dr. Conley, to say a few words.
Thank you. Are you able to hear me all right?
Yes, I can.
They set a camera up and I'm in the clinic, but it may not be working. So I don't know if you can see me or not.
I can't see you right now, but
okay.
My display.
Anyway, there it looks like it might be coming on, but if not, I just wanted to say thank you very much. Thank you very much to the O'Brien Institute for Public Health. I was very honored to actually be nominated and then to be a recipient of the Research Excellence Award. I'm very humbled. I'm inspired by many of the researchers in the O'Brien Institute, and as someone who is a seeker of scientific truth and trying to provide new and engaging literature that would make a difference at the end of the day, I'm inspired by all of the people that I associate with in the O'Brien Institute, and it makes me want to work that much harder because I see what others are doing. I do feel that I'm probably the least likely to have received it compared to others when I look at the fabulous work that people do around the Institute. But nonetheless, I am delighted and honored to have been chosen as this year's recipient, and hopefully I can live up to the nomination and the receipt with the work that I'll try to complete over the next year. So thank you very much on behalf of all of you who are involved in the nomination process.
Thanks very much, John. I'm really happy that you were able to join us today, and congratulations to you. Very well deserved.
Thank you.
Thank you, then. And our final award is to Dr. Megan McDonough, and she's receiving the 2021 O'Brien Institute's Lynn Mcintyre Outstanding Service Award. So over to you, Megan.
Thank you, Christine. It's an honor to receive this award, especially since Lynn Mcintyre is such a role model of leadership and service. So I'm honored. Getting involved in O'Brien when I came to the university really helped me establish collaborations and get support for my research and making connections in the community for my work. So getting involved and giving back to the Institute through service was important to me, including things like through the Brenda Stratford Center on Aging, Make Calgary, and some of the initiatives at the Institute as a whole. So it's been important for me in terms of giving back. It's also been a great opportunity to continue to be involved and stay connected with this important network at O'Brien. So I'm honored that that work has been recognized as contributing to the Institute. It's certainly been a mutually beneficial relationship. So thank you very much.
Well, thank you very, very much for your contributions. They've definitely been noted and appreciated by all of us. So that concludes our award ceremony, and I'll hand it over to Tom to give some closing remarks.
Great. Thank you, Christine. So our goal is to finish by 12, and it looks like we're going to accomplish that. I've just got a couple of minutes here of comments. So let me briefly recap my observations from our time together. Today we've heard Institute updates, including some of the incredible accomplishments of our colleagues. You've reviewed our draft strategic plan, and you've discussed opportunities for concentrated activities and focus. It sounds like there is considerable opportunity there for overlap between our population health and our health systems scientists for us to think about. And you've celebrated the Institute's award winners, David Campbell, and Cheryl Barnaby, Turin Chowdhury, John Conley, and Megan McDonough. Congratulations to all of you, and thank you for the work you do. As an institute, we'll now move forward and finalize a strategic plan in the coming months. If you have any last minute suggestions beyond what we talked about today, please send me an email. Our goal is to present the plan to our strategic advisory board in December, and then we'll begin implementation in the new year, which will be probably an even more important challenge. And I guess I'd like to finish off by simply saying that, it's been a tough year for a lot of people. We're surrounded by what feels to be a never-ending series of public health challenges. And I want to thank you all for all the work you do to advance public health through research excellence. We're better and healthier for your efforts. And if I can ever be of assistance, reach out. And finally, please make sure to take care of yourselves and stay well. So thank you for joining us today. And I wish you a good rest of your day and a good upcoming weekend. Take care and bye for now.
Bye, everyone.
Bye. Thanks everyone for coming.